Welcome back to Vital Men 60, our series on men's health. In today's video, we'll dive into a critical topic. When should you see a doctor when dealing with erectile dysfunction, ED? This isn't just an issue that impacts your sex life. It can also be a warning sign of more serious health conditions. What is erectile dysfunction? Erectile dysfunction, ED, is defined as the persistent difficulty in achieving or maintaining an erection sufficient for satisfactory sexual activity. It's a common condition, yet many men hesitate to talk about it due to stigma or embarrassment. Why should you pay attention to ED? ED is more than just a sexual function issue. It can serve as an early warning sign of serious health conditions such as cardiovascular disease, diabetes, or hormonal imbalances. Recognizing and addressing ED promptly can improve your quality of life and, in some cases, even save your life. Statistics on ED. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, ED affects approximately 30 million men in the United States. Symptoms and causes of erectile dysfunction. The Massachusetts Male Aging Study, MMAS, found that 52% of men aged 40 to 70 experience some degree of ED, prevalence of erectile dysfunction. A study in the Journal of Sexual Medicine shows that the prevalence of ED increases with age, 40% in men aged 40, 50% in men aged 50, and up to 70% in men aged 70, age and erectile dysfunction. Goal of this video. We aim to help you identify the key signs to watch for, overcome any hesitation, and take proactive steps to seek medical help when needed. Let's dive into the details. Part 1. Signs to watch for erectile dysfunction, ED, is not merely a sexual function issue. It can signal underlying health problems. Recognizing the signs of ED early is crucial for protecting your health. In this section, we'll explore the primary symptoms of ED, associated symptoms, and warning signs of serious conditions. All information is grounded in scientific research from reputable sources such as the Journal of Sexual Medicine, Mayo Clinic, and Cleveland Clinic. 1. Primary signs of erectile dysfunction, ED. ED is defined as the difficulty in achieving or maintaining an erection sufficient for sexual activity. According to the NIDDK, ED affects approximately 30 million men in the U.S. Symptoms and causes of erectile dysfunction. Here are the 3 main signs to watch for. A. Difficulty achieving an erection. Description: you are unable to achieve an erection despite adequate sexual stimulation. This may occur in most sexual encounters, or only occasionally. Causes. This can result from vascular issues, hormonal imbalances, or psychological factors. According to Mayo Clinic, approximately 80% of ED cases have a physical cause, with vascular problems being the most common. Erectile dysfunction. Symptoms and causes. B. Difficulty maintaining an erection. Description: you can achieve an erection but cannot sustain it long enough for sexual intercourse. The erection may fade during the act or lack sufficient firmness. Causes. This is often linked to impaired blood flow or nerve damage. A study in the Journal of Sexual Medicine found that men with diabetes are 3 times more likely to struggle with maintaining an erection compared to healthy men. Diabetes and erectile dysfunction. C. Reduced sexual desire. Description: you experience a lack of interest or reduced desire for sexual activity, which may occur alongside erection difficulties or independently. Causes. This is often due to hormonal imbalances, particularly low testosterone levels, or psychological factors like stress. According to Cleveland Clinic, 10 to 20% of men with ED have low testosterone and erectile dysfunction. If any of these signs persist for more than 3 months, it's a clear indication that you should consult a doctor. The American Urological Association emphasizes that early diagnosis and treatment can significantly improve quality of life and prevent health complications. Erectile Dysfunction Clinical Guidelines. 2. Associated symptoms. ED rarely occurs in isolation. It is often accompanied by other symptoms that may point to underlying health issues. Below are the key associated symptoms to watch for. A. Pelvic pain or discomfort. Description: persistent pain, aching, or discomfort in the pelvic area, which may radiate to the penis or testicles. Causes: this could be related to prostate issues, such as prostatitis or benign prostatic hyperplasia, BPH. A study in the Journal of Urology found that men with prostatitis have a 2.5 times higher risk of ED compared to those without prostatitis and erectile dysfunction. B. Frequent nighttime urination or difficulty urinating. Description: waking up multiple times at night to urinate, or experiencing issues like hesitancy, weak stream, or incomplete bladder emptying. Causes: these are common signs of diabetes or prostate issues. According to Diabetes Care, 35–75% of men with diabetes experience ED, and frequent nighttime urination is a prevalent symptom. Erectile dysfunction in diabetes. C. Fatigue or lack of energy. Description: persistent tiredness, lack of vitality, or insufficient energy for daily activities, even with adequate rest. Causes: this could indicate low testosterone levels or underlying conditions like cardiovascular disease. A study in the Journal of Clinical Endocrinology and Metabolism found that men with low testosterone are more likely to experience fatigue and ED, testosterone and fatigue. D. Mood changes. Description: feelings of anxiety, depression, or chronic stress, particularly related to sexual performance, which may lead to avoidance of intimate situations. Causes: ED and psychological issues often have a bidirectional relationship. Psychological medicine reports that men with depression have a twofold higher risk of ED, depression and erectile dysfunction. If you notice any of these symptoms alongside ED, consider it a prompt to seek medical attention as soon as possible. 3. Warning signs of serious health conditions. ED is not just a sexual issue. It can act as a red flag for more serious health conditions. Below are key conditions that ED may signal. A. Cardiovascular disease. Connection: ED shares risk factors with cardiovascular disease, such as atherosclerosis, hypertension, and high cholesterol. According to the Journal of the American College of Cardiology, men with ED have a 50% higher risk of heart disease, erectile dysfunction, and coronary artery disease. Signs: sudden onset of ED or accompanying symptoms like chest pain, shortness of breath, or fatigue during exertion warrant immediate medical evaluation. B. Diabetes. Connection: diabetes damages blood vessels and nerves, contributing to ED. The American Diabetes Association notes that 35–75% of men with diabetes experience ED, diabetes, and sexual health. Signs: symptoms like excessive thirst, frequent urination, or slow-healing wounds alongside ED suggest the need for blood glucose testing. C. Hormonal imbalances. Connection: low testosterone is a common cause of ED in older men. Mayo Clinic estimates that 10–20% of ED cases are linked to hormonal issues, low testosterone and erectile dysfunction. Signs: reduced libido, fatigue, or loss of muscle mass may indicate the need for testosterone level testing. D. Neurological disorders. Connection: conditions like Parkinson's disease, multiple sclerosis, or spinal cord injuries can disrupt nerve signals, causing ED. A study in the Journal of Neurology Neurosurgery and psychiatry found that ED is common in men with Parkinson's disease, erectile dysfunction in Parkinson's disease. Signs: symptoms like tremors, muscle stiffness, or balance issues alongside ED require consultation with a neurologist. 4. Key statistics. To highlight the prevalence and importance of early recognition of ED, here are some notable statistics. According to the International Journal of Impotence Research, men who smoke have a 1.5 to 2 times higher risk of ED due to vascular damage, smoking, and erectile dysfunction. A study in the Journal of Sexual Medicine found that obese men have a 30% higher risk of ED compared to those with normal weight, obesity, and erectile dysfunction. Cleveland Clinic reports that 25% of ED cases are linked to medication side effects, particularly antidepressants and antihypertensives, medications, and erectile dysfunction. These statistics underscore that ED is not an isolated issue, but often tied to lifestyle factors and underlying conditions, making early action critical. Part 2. When should you see a doctor? Erectile dysfunction, ED, is not just a sexual performance issue. It can be a warning sign of serious health conditions. Yet, many men delay seeking medical help due to embarrassment or stigma. This section provides detailed information on the specific signs of ED, associated symptoms, and why timely medical consultation is essential. All information is supported by scientific research from sources like the Journal of Sexual Medicine, Mayo Clinic, Cleveland Clinic, and NIDDK. 1. Understanding the primary signs of erectile dysfunction, ED. ED is defined as the inability to achieve or maintain an erection sufficient for sexual intercourse. According to the NIDDK, it affects approximately 30 million men in the US. Symptoms and causes of erectile dysfunction. Below are the key signs to recognize. A. Difficulty achieving an erection. Manifestation: you cannot achieve an erection despite adequate sexual stimulation from a partner or other stimuli. Visual or auditory. This may occur frequently, 50% of sexual encounters, or occasionally, 25%. Potential causes, often linked to poor blood flow, nerve damage, or psychological issues like anxiety. Mayo Clinic notes that 80% of ED cases are due to physical causes, particularly vascular issues, erectile dysfunction, symptoms and causes. When to see a doctor? If this occurs in more than 50% of sexual encounters and persists for over 3 months, consult a urologist or men's health specialist. B. Difficulty maintaining an erection. Manifestation: an erection is achieved initially but fades before or during intercourse, or lacks sufficient firmness. For example, the penis may soften mid-act or fail to reach full rigidity. Potential causes, often related to vascular issues, atherosclerosis, or nerve damage from diabetes. A Journal of Sexual Medicine study found that men with diabetes are 3 times more likely to have this issue, diabetes and erectile dysfunction. When to see a doctor? If this occurs frequently, 75% of encounters, for 2 to 3 months, seek a comprehensive health evaluation, focusing on blood glucose and cardiovascular health. C. Reduced sexual desire. Manifestation: a lack of interest in sexual activity, even when opportunities or stimuli are present. This may accompany erection difficulties or occur independently. Potential causes, often due to low testosterone, chronic stress, or depression. Cleveland Clinic notes that 10 to 20% of ED cases are linked to low testosterone and erectile dysfunction. When to see a doctor? If loss of libido persists for over 3 months and impacts personal life. Test hormone levels and mental health. Note: the American Urological Association recommends consulting a doctor if any of these signs persist for over 3 months, to ensure accurate diagnosis and timely treatment. Erectile dysfunction clinical guidelines. 2. Associated symptoms to watch for ED is often accompanied by other symptoms that may indicate serious health issues. Below are key symptoms to monitor. A. Pelvic pain or discomfort. Manifestation: persistent aching, soreness or discomfort in the pelvic region, penis, or testicles, especially after intercourse or prolonged sitting. Potential causes may be due to prostatitis or benign prostatic hyperplasia, BPH. A Journal of Urology study found that men with prostatitis have a 2.5 times higher risk of ED, prostatitis and erectile dysfunction. When to see a doctor: if pain persists for over 1 month or disrupts daily activities, consult a urologist. B. Frequent nighttime urination or difficulty urinating. Manifestation: waking up more than twice nightly to urinate or experiencing hesitancy, weak stream, or incomplete emptying. May include burning during urination. Potential causes: linked to diabetes or prostate issues. Diabetes Care reports that 35 to 75% of men with diabetes experience ED, with frequent nighttime urination as a common sign. Erectile dysfunction in diabetes. When to see a doctor: if symptoms persist for over 2 weeks or include signs of infection, cloudy or foul-smelling urine, seek immediate evaluation. C. Prolonged fatigue and lack of energy. Manifestation: feeling exhausted or lacking energy for daily tasks, even after adequate rest. Potential causes may indicate low testosterone, cardiovascular issues, or poor circulation. The Journal of Clinical Endocrinology and Metabolism found that men with low testosterone are more prone to fatigue and ED, testosterone and fatigue. When to see a doctor: if fatigue lasts over 1 month and affects quality of life, check hormone levels and cardiovascular health. D. Mood changes or anxiety. Manifestation: persistent anxiety, depression, or lack of confidence, especially regarding sexual performance, leading to avoidance of intimate situations. Potential causes: ED and psychological issues often exacerbate each other. Psychological medicine notes that men with depression have a 2-fold higher risk of ED, depression and erectile dysfunction. When to see a doctor: if negative moods persist for over 2 months or strain relationships, consult a psychologist or men's health specialist. 3. ED as a warning sign of serious conditions. ED can serve as an early indicator of serious health issues. Below are common conditions linked to ED. A. Cardiovascular disease. Connection: ED often precedes cardiovascular issues by 2 to 5 years due to atherosclerosis reducing blood flow. The Journal of the American College of Cardiology reports a 50% higher risk of heart disease in men with ED, erectile dysfunction, and coronary artery disease. Associated signs: chest pain, shortness of breath, or fatigue during exertion. B. Diabetes. Connection: diabetes damages blood vessels and nerves, causing ED. The American Diabetes Association states that 75% of men with diabetes experience ED, diabetes, and sexual health. Associated signs: excessive thirst, frequent urination, or slow-healing wounds. C. Hormonal imbalances. Connection: low testosterone contributes to ED and reduced libido. Mayo Clinic estimates 10 to 20% of ED cases are hormone-related, low testosterone and erectile dysfunction. Associated signs: muscle loss, fatigue, or hair loss. D. Neurological disorders. Connection: conditions like Parkinson's or spinal cord injuries disrupt nerve signals, causing ED. The Journal of Neurology, Neurosurgery and Psychiatry notes that ED is common in men with Parkinson's, erectile dysfunction and Parkinson's disease. Associated signs: tremors, muscle stiffness, or balance issues. When to seek immediate care: if ED appears suddenly or is accompanied by severe symptoms like chest pain, shortness of breath, or tremors, visit a hospital immediately. 4. Conclusion and advice. ED is not something to be ashamed of or ignored. It can impact overall health and signal serious conditions. Watch for these signs: difficulty achieving or maintaining an erection for over 3 months, persistent reduced sexual desire, associated symptoms like pelvic pain, frequent urination, fatigue, or mood changes. Don't delay. If you experience these signs, schedule a consultation with a specialist for a thorough evaluation. Early treatment can enhance quality of life and prevent serious complications. Act today to safeguard your health. Part 3. The diagnostic process for erectile dysfunction. Erectile dysfunction, ED, is the difficulty in achieving or maintaining an erection sufficient for sexual intercourse. To diagnose and treat it effectively, doctors follow a comprehensive process involving medical history collection, physical examination, laboratory tests, psychological evaluation, and sometimes specialized tests. This section explains each step in detail, helping you understand how ED signs are assessed by medical professionals. 1. Medical history collection. The first step in diagnosing ED is gathering detailed information about your health and symptoms. This helps doctors understand the context and identify risk factors. A. Symptoms and onset. Signs to watch. 4. You may notice an inability to achieve an erection, or erections that are not firm or sustained. Some men experience issues only in specific situations, with a partner, but not during self-stimulation. Typical questions. When did the symptoms start? How often do they occur? Significance. According to Cleveland Clinic, sudden onset ED is often linked to psychological factors like stress, while gradual onset may indicate physical issues like vascular disease. Erectile dysfunction diagnosis. B. Medical history and medications. Signs to watch for. Conditions like diabetes, hypertension, or heart disease may contribute to ED. Certain medications, such as antidepressants or antihypertensives, can also play a role. Typical questions. Do you have any chronic conditions? What medications are you taking? Significance. Mayo Clinic notes that 25% of ED cases are linked to medication side effects, such as beta blockers reducing penile blood flow, medications and ED. C. Lifestyle and habits. Signs to watch. 4. Smoking. Excessive alcohol consumption or a sedentary lifestyle can signal ED risk. Typical questions. Do you smoke? How much alcohol do you consume weekly? Significance. A Journal of Sexual Medicine study found that smokers have a 1.5 to 2 times higher risk of ED due to vascular damage, smoking and ED. D. Psychological and relationship factors. Signs to watch for. Anxiety, stress, or loss of sexual interest may indicate psychogenic ED. Typical questions. Are you experiencing work-related stress? How is your relationship with your partner? Significance. Psychological medicine reports that men with depression have a 2-fold higher risk of ED, depression and ED. 2. Physical examination. A physical exam helps identify physical signs related to ED, from cardiovascular issues to genital abnormalities. Blood pressure and heart rate check. Signs to watch. 4. High blood pressure or irregular heart rate may indicate cardiovascular disease, a common ED cause. Significance. The Journal of the American College of Cardiology notes that ED increases heart disease risk by 50%. ED and heart disease. B. Genital examination. Signs to watch for. Abnormal penile curvature, Peyronie's disease. Small testicles or scarring can affect erectile function. Process. The doctor examines the shape, size, and sensation of the penis and testicles. C. Hormonal signs assessment. Signs to watch for gynecomastia. Hair loss or reduced muscle mass may indicate low testosterone. Significance. Low testosterone affects 10 to 20% of ED cases. Low testosterone. D. Neurological assessment. Signs to watch for loss of sensation in the genital area may result from nerve damage due to diabetes or injury. Process. The doctor tests reflexes and sensation to evaluate nerve function. 3. Laboratory tests. Blood and urine tests provide scientific evidence to identify underlying conditions. A. Blood tests. Blood glucose. Diabetes damages blood vessels and nerves, causing ED in 35–75% of men. American Diabetes Association. Cholesterol. High levels contribute to atherosclerosis, reducing penile blood flow. Testosterone. Low levels can reduce libido and erectile capacity. Thyroid function. Thyroid disorders affect hormones and sexual function. B. Urine tests. Significance. Detect signs of diabetes or infections that may contribute to ED. 4. Psychological assessment. ED can have psychological roots, and this evaluation identifies emotional factors. A. Questionnaires tool. The International Index of Erectile Function, IIEF, assesses ED severity and psychological impact. Significance. Approximately 10 to 20% of ED cases are psychogenic. Journal of Sexual Medicine. B. Discussion of stress and relationships. Signs to watch for performance anxiety, partner conflicts, or depression may contribute. Process. The doctor may refer you to a psychologist if needed. 5. Specialized tests when necessary. Specialized tests distinguish between physical and psychological causes. A. Nocturnal penile tumescence, NPT. Testing. Description. Measures natural erections during sleep, 3 to 5 times nightly in healthy men. Significance. Normal NPT suggests a psychological cause, Cleveland Clinic. B. Penile Doppler ultrasound. Description. Assesses blood flow after injecting a medication to induce an erection. Significance. Detects vascular blockages, a common ED cause, Journal of Sexual Medicine. C. Intracavernosal injection test. Description. Injects alprostadil to test erectile response. Significance. Lack of response may indicate vascular issues. Mayo Clinic. 6. Statistics and advice. Statistics. The Massachusetts Male Aging Study found that 52% of men aged 40 to 70 experience ED. ED is also a warning sign for heart disease. Journal of Sexual Medicine. Advice. Don't be afraid to seek help. ED is treatable, and early diagnosis can uncover serious health issues. This process not only identifies the cause of ED, but also improves overall health. Act today. ED is not something you have to endure in silence. It's a treatable medical condition, and early action offers numerous benefits. Don't feel ashamed about seeking help. Millions of men worldwide face ED. You are not alone. View this as an opportunity to prioritize your overall health. Treating ED not only enhances your sex life, but also helps detect and manage serious conditions. Your health is your most valuable asset. Protect it. In our next video, we'll explore effective treatment options for ED, from lifestyle changes to advanced medical interventions. Stay tuned to learn more. If you found this video helpful, please hit like, subscribe, and share to spread this vital information to those who need it. Thank you for watching, and we'll see you in the next video.